Thank you, Steve, for that very nice introduction. I'm here today representing the Summit Institute of Development and presenting also on behalf of my colleague, Ms. Anissa Dwi Utami. The talk today is going to be about advancing maternal micronutrient supplementation with digital health tools. And I'm going to present to you a case study with OpenSRP, Open Smart Register Platform, and how in Indonesia, the Summit Institute has been able to explore tracking maternal multiple micronutrient supplementation in the context of maternal health. Just a very quick introduction to the Summit Institute of Development. Their vision is to improve public health and human development. They're located in Indonesia on Lombok Island, which some of you may know is the island right next to Bali. Their mission is improving maternal and neonatal health, focusing on information and communication technology, and improving human resources. Some of the key accomplishments of the Summit Institute of Development, they had conducted the first large-scale trial of multiple micronutrient supplementation. In fact, and this was one of the trials that facilitated the recent WHO global recommendation for multiple micronutrient supplementation. Later in 2015, Summit Institute of Development was a co-founder of the Open Smart Register platform, which is this open source digital health tool for frontline workers. And I'm going to be speaking with you more about that today. And in 2017, they actually carried out the largest, most detailed study of child cognition, which showed really a very interesting finding that, in fact, nurture is much more important than nature with respect to child cognitive development. So that was a very important finding. And they've been very busy, unfortunately, in 2020. They are a founding partner, in fact, of the largest COVID-19 lab in Indonesia. I just want to highlight here some of the partnerships involved in this work I'm going to be presenting to you today. SID works with multiple people within Indonesia, organizations internationally as well, and several different donor groups support them. So let me give you first an introduction to this Open Smart Register platform, OpenSRP as it's called. It's a integrated digital health information system for frontline health workers. You can go to smartregister.org to learn more about this. This was actually launched as an initiative to create an open source tool for frontline health workers in collaboration with World Health Organization, ONA Systems, Johns Hopkins, myself, Summit Institute of Development, IRD in Pakistan, and Empower in Bangladesh. This really group of people was focused on creating this new type of platform. And amazingly, in 3 or 4 years, became very successful. Some of the key features of OpenSRP in Indonesia, it really supports the workflow of the frontline health worker. In the case of Indonesia, focusing on midwives who provide antenatal care, delivery, and postnatal care, vaccinators, and nutritionists. Some of the features include integration with chatbots, advanced analytics, in-app reporting, so it works as a job aid, the ability to acquire information from, let's say, a blood pressure cuff. So it's quite an integrated system. So as a starting point of really why this OpenSRP is important, I wanted to highlight really in many countries the current status of maternal care. And it's what we refer to as being provider-centered care. So here in this diagram, you can see, for example, in Indonesia, if you have the pregnant woman here, in fact, during her care, she may need to seek out and work with persons at the community health center, village health post, maybe persons providing community outreach for antenatal care for her, including persons at the birth center, and her child may be visited by a person from the Early Childhood Development Center, or she may have to go there. So there's at least 5, sometimes more different persons or contact points that are required. And it's really up to her to go and seek these different individuals and facilities who are not necessarily coordinating their work between them. So what we decided to do with OpenSRP, and a bit of this complicated diagram here, is we decided that all these different health workers and the information they collect, in fact, can be integrated and networked together. And we could create this OpenSRP network system of providers. So in this diagram, you can see here the midwife. She has several different information registers she keeps. Here on the right, you can see the vaccinator, an early childhood development worker on the lower left, and a nutritionist. So all these different workers with OpenSRP apps are able to integrate their information and their care. This leads to this system that we refer to as the OpenSRP ecosystem of care, which is actually a client-centered approach. And this enables you to maintain really the continuity of care of the pregnant woman throughout the pregnancy and the delivery with different workers, and afterwards track the delivery of the child and provide the proper care for the child. So it's in this region here of the pregnancy that the integration with multiple micronutrient supplementation can become important. So what about this antenatal care and OpenSRP? Well, here we see some evidence of a deployment of OpenSRP over a 1-year period with midwives showing this improvement in coverage in antenatal care. And this actually led to increased compliance with iron folic acid supplementation and what you might expect actually to see with multiple micronutrient supplementation. In further follow-up of this particular work, we could see here that in fact, as a result of deployment of OpenSRP and increased consumption of nutrient supplements during pregnancy, there was a reduction in maternal anemia. In addition to that, we can see very clearly in another area, this matched pair deployment, again, increase in antenatal care, increase particularly in postnatal care, and actually a reduction in mortality. So it's very clear that such systems can lead to improvements of care, can be very useful for tracking multiple micronutrient supplementation and utilization. So the next steps really for OpenSRP and integrating with multiple micronutrient supplementation programs relates to this work that we're doing now, where essentially taking the WHO recommendation for antenatal care, including the most recent change related to multiple micronutrient supplementation, and integrating that into this digital tool that is a companion to those written guidelines, and focusing specifically on the aspect of it related to maternal nutrition, and introducing an additional screen for tracking and recommendation related to the prescribing of multiple micronutrient supplementation, including screens to assess the adherence. So this leads us to really the next aspect of this work is it's great you can integrate multiple micronutrient supplements, track that, promote that, but what is the supplement really that would be the most interesting? So this is work that Summit Institute of Development has launched that they refer to as the Global Nutrition Development Initiative, GND, or in short, they call it the GND program. And in GND, they've developed a chatbot. And what this chatbot does, it reaches out to pregnant women or women of reproductive age, and it's able to ask them that if they were to consume a multiple micronutrient supplement, what are the specifications of the design of that? Not the composition, but the design. For instance, the packaging, the appearance, tablet versus capsule, and so forth. So through interaction with them, through this chatbot, this information can be gathered. And this is just a screenshot showing how the GND introduces itself, what GND stands for, and what Summit Institute is, and so forth. But then it starts to present a series of questions to the woman, asking her to talk about what she prefers in terms of the design of the supplement. And you can answer these sorts of questions as a result of this real-time data coming in through GND. Did the woman prefer the supplement in either a bottle or a blister pack? Here you can see that somewhat similar. However, the bottle is a little bit more disliked for various reasons, but not too much different. And how many per package. So you can see here, this is quite interesting, that 180 tablets or supplements per pack is not a well-liked type of distribution format. Really, 30 per pack is something more the women prefer for various reasons. In addition to that, this issue in Indonesia is very important, that the supplement being halal. And so here we see 2/3 of the women saying this, they agree strongly that this halal issue is extremely important. So if one were to design a supplement that women would want to consume in Indonesia, you would have to take into account these characteristics and several of the others that I've not mentioned it to you. And there are, in fact, a myriad number of options for maternal micronutrient supplementation in Indonesia. So what we were interested in was actually assessing how these supplements are adhering to the GNED preference index for supplements to be consumed by the population. So we were able to go through, do a ranking of these supplements, their appearance and so forth, and develop this preference index. So here you see on the x-axis this preference index. On the y-axis, I show you the cost per 100 supplements. And then as a bubble plot, the size of the bubble is indicative of what we calculate as the predicted utilization. So this is a model data analysis. And interestingly enough, what you can see is that, in fact, supplements that are the cheapest are not necessarily the ones that you might expect to have better predicted utilization. If you go up to a higher preference index, sort of in the intermediate area, with some increase in cost, this actually leads to a substantially larger predicted utilization index. And as you get up to very highly preferred supplements, but with a high price, you can see the utilization, predicted utilization is also not so high. So what does this mean? This means really with respect to multiple micronutrient supplement design, a better supplement will lead to better impact, and a lower cost supplement may not actually be the best option. So currently, the Summit Institute of Development is working with multiple partners to do a project known as the Advanced Network for Care at Scale, and this relates to scaling up of open SRP and multiple micronutrient supplementation to over 20 districts, 15 million persons, assessing the impact of this as a stepwise randomized trial in a programmatic context, integrating it with national health insurance and strengthening the frontline workforce. So with that, I would like to say thank you very much, and to emphasize that I think one of the key take-homes from this presentation is that digital tools and product design can optimize maternal multiple micronutrient supplementation scale-up and impact. So thank you for your time.